Should everyone in mental health be talking about food? I'm just going to say it. Yes, based on the evidence right now, 2021, if you are talking about mental health or thinking about mental health, you want to include nutrition and a conversation about food in that conversation based on the most recent evidence. Hey everyone, welcome back. I'm Dr. Drew Ramsey. I'm one of the leaders in this field, nutritional psychiatry. And so let's talk about what that is. It's the combination of mental health care, psychiatry and psychology, and nutrition and food, how we think about food and how we nourish ourselves. Let's just talk about the evidence that's come out just in the last 10 years, because if you're not thinking about mental health, brain health, and nutrition, you're missing a huge opportunity. It doesn't matter if you're a patient, if you're a clinician, if you're just kind of curious about how the brain works and how the mind works, nutrition definitely should be a part of that conversation. So let's talk about this evidence. First, let's just start with the correlational studies. We all know correlation does not equal causation. There, I said it. Everyone knows that. But correlational data, that's the data where we're looking at a population. For example, if people eat more seafood over their lifetime, does that matter to the risk of depression? Or if a new mom is eating lots and lots of seafood and lots of leafy greens, lots of plants, does that matter in terms of her mental health? These are the types of questions that nutritional psychiatry is asked and now has lots of answers to. So if, for example, you're headed off to college or you're the parent of a college student, there's a lot of data now that you should be encouraging that student to eat the Mediterranean diet. That's right, eating more olive oil, more plant, more nuts, because there's been a significant amount of evidence saying that the quality of an individual's diet in college directly correlates to the risk of depression and anxiety. And this is a time period we know where there's a lot of burden of depression and anxiety coming on, especially now for young individuals, teens, and college students and students. So that's some of the correlational data. There's a lot more, but if you line it all up, it looks like individuals who eat a healthier diet, that's a diet with more plants, more seafood, more olive oil, more nuts, more rainbows or brainbows, as we call them in nutritional psychiatry, those individuals have a 20 to 30% decreased risk of depression and anxiety. So as I said, correlation doesn't equal causation. To really understand causation, we need randomized clinical trials. And this is the real reason why, as I said earlier, everyone in mental health needs to start talking or thinking about nutrition and food. That's because there's so much interesting data when it comes to randomized trials now. These are the gold standard in medicine, and there have been 5 randomized trials looking at food, that's right, just using nutrition to treat clinical depression. Now, just to note, these studies usually are added on to treatment as usual. There's an augmentation strategy. So individuals, many in the study, are already taking an antidepressant medication or some other medication and already in some type of psychotherapy. But let's talk about a couple of these trials. The first, the SMILES trial, it looked at 67 individuals who were most of them in treatment, and it found that those who were given a Mediterranean-style nutritional counseling, they got 7 sessions, 33% of those individuals went to full clinical remission. I mean, that's astounding. If that was a medication, it would be a blockbuster drug. But it's just simple food. Not only did they get better, this was one of my favorite parts, individuals saved over $1,000 a year. That's right, eating all this brain food, it's actually less expensive, because so often we hear that barrier, hey, all these organic blueberries and stuff you all are talking about, it's really expensive food. What I love about the SMILES trial is it showed us, 1, individuals in mental health settings can really change how they eat, and number 2, it saved them money, and number 3, it got their depression a lot better. So after that, the second trial was the Healthy Med trial. This was one of my favorite trials because it used a group-style Mediterranean cooking class. This is a lot like the cooking class we've developed in our clinic, the Mental Fitness Kitchen. It's a digital cooking school. I hope you'll check it out and join some of our classes with Chef Emily Berner and our team. We do all kinds of wonderful things and make things like gazpacho and succulent shrimp salad and baked sardines and all these amazing brain foods that I needed some help learning how to cook and prepare to really get my diet up to speed. So the Healthy Med trial did this intervention, and these were individuals with actually really severe depression, and it found that the majority of them dropped their depression and anxiety rating scales by about half. So just another remarkable trial. After that, a third trial. This one was with college students. All they gave was a 13-minute video. They gave the college students who were pretty depressed a little box that had like olive oil, cinnamon, turmeric, and they gave them, some recipes and advice and encouragement. They showed them this video. Then they called them like the next week for 5 minutes, like, "Hey, Drew, how's it going? Are you like using the olive oil? Eat more vegetables." Like, kind of encourage them. Another call a week later. So we're just talking, what was that, 23 minutes and no in-person contact time. I mean, when I hear this with college students saying this is definitely going to fail, right? Nope. Actually, the results were amazing. At 3 months, the students had significantly decreased rating scales of depression, anxiety, and stress. And that lasted for 6 months. So this is one of the studies, these are some of the studies that really support this idea that everyone in mental health needs to be thinking about nutrition. What are your patients eating? If you're a patient, what are you eating? Are you supporting your mental health? Are you feeding your mental health with food? For clinicians, that's one of the reasons we developed our clinician training. It's a 10.25-hour continuing medical education or continuing education hour class. So it goes over all of the basics of nutritional psychiatry, all of the evidence that we just talked about, the SMILES trial, Sun Navarro, Healthy Med. It talks about the clinical techniques that we use in the brain food clinic that we've developed with our clinicians to help best assess and then help people change how they eat to best feed their brain and feed their mental health. I hope these reasons compel you to think about how your eating and your food relates to your mental health. And if you're in mental health treatment, if you're a mental health clinician, I hope it encourages you and excites you about all of the new science and the new data coming out in this field, nutritional psychiatry. I'm Dr. Drew Ramsey. Please subscribe below. Sign up for our Friday Feels newsletter. As I said, join us in the Mental Fitness Kitchen, our digital cooking class, and I hope to see you soon. Take care.